I'd like to tell some of our viewers our position, our opinions on the team approach to spinal surgery.
I basically am trained in general and vascular surgery and provide access to the spine through the front. Traditionally, you've heard and you know that the spine is usually approached through a rear incision or posterior, but through the front, the obstacles are a little different, such as the bowel and the large great vessels going to your legs. And I mobilize or move these organs and vessels with minimal blood loss and tissue destruction to provide the spinal surgeon, Dr. Cappicato, the proper access and to the level that he wants to replace the disc.
I maintain that the reason is that there's two surgeons treating that patient, and the name of our group, Your Spinal Team, may sound silly to some, but it's about you, it's about your patient, and we want to make sure that our patients have the best treatment possible, that they have the best results, and the minimal amount of complications.
The other benefit of the team approach is post-operative care. I mean, there's post-operative complications in every surgeries. Wound problems, bowel problems, blood clots in the legs. There's two of us. We're there every day seeing the patients. We're constantly communicating with each other.
I've found that this team approach to be very satisfactory. As you can see, Dr. Cappicato is very particular about his part and where and how that prosthesis gets placed. And the ultimate success of the operation is really dependent on just how accurately that prosthesis is placed. By utilizing this team approach, he can focus on that part of his operation. I can focus on my part, which is to give him the exposure that he needs to accomplish his part satisfactorily.
It's our opinion that working together as a team makes a more coordinated, safer, and effective operation.
It was the best decision I ever made. The numbness and tingling is gone. Total disc replacement has saved me from constant pain and immobility.
Came to me requesting surgery in the form of a disc replacement as an alternative to spinal fusion. He was certain that he did not want to have a spinal fusion. He underwent total disc replacement. He went back to working heavy labor in November of 2008. He's been back for 7 months.
Yes.
And working full duty. He has a full range of motion, not taking any pain medicine, correct?
No.
And performing heavy duty manual labor, including busting concrete. George, if you'd be good enough, if you can just to show our viewers your range of motion, just extension of your neck. Not bad. How about turning to your right and left? How do you feel a year after surgery?
I think for myself, I felt that future-wise, for health, for myself was going to be bleak. I really didn't think that the surgery was really going to work this well either. I didn't feel that I'd have this kind of result. I still thought that I still had pain and still have problems afterwards. But that's been the complete opposite. I got zero pain, got don't have to take any medication, and I'm not limited to anything. So it really worked well for me. So the future for me is no longer bleak. Now I can work, progress into making a good future for myself and my family. So it worked out well for me.
I'm back to work and it feels great. I work full-time, full duty with no medication.
We operated on a young fellow, came up here, had his disc replacement. His father brings him back. Now this poor fellow hasn't been able to work in about 18 months. And his father said to me, he goes, you gave my son his life back. That's a big deal. With the spinal fusion, that man would still be suffering. There's no doubt in my mind. And he probably would never go back to work. This way, with the disc replacement, I'm certain he's going to go back. He'll be back to work in 6 months. I hope this presentation gave you enough information in regards to their injuries to the neck or low back. Fortunately, they now have a choice between having the classic spinal fusion and an operation that we believe is a better operation for most patients, and that is total disc replacement. More of our patients are able to return to vigorous activities after surgery. More of our patients go back to work. More of our patients have full range of motion. Our patients have superior results because of our team approach. There's no doubt in my mind that this is the most significant development in spine surgery that we've had in the United States in the past 40 or 50 years.
Suffering from a serious back or neck injury? Faced with the decision of having a spinal operation? Spinal fusion, welding two bones together, used to be the only answer. Now you have a choice. With a unique team approach led by Dr. William Capicotto, total disc replacement has eliminated pain and restored movement, enabling patients to return to work and a more normal lifestyle. Your Spinal team, restoring motion to your spine so you can move on with your life.